having more muscle mass. Many things is more. Their heart size is more. Their stroke volume is more. Their cardiac output is more. Okay, there are so many things. Their muscle mass, as I said, that is more. So because of that, their performance is more. And height is also, it is seen, those who are having higher height, so they can perform better. And physical build. Physical build, the obese person, they will not be able to very thin person, they will not be able to do better performance. Only those who are not thin, also not obese, those who are fit, healthy, they will be performing better. Training. Obviously, by training, we develop muscles. We develop our cardiac activity. We develop our mitochondria. We develop capillaries among the muscles so that more oxygen, more blood is supplied to the muscles so that the muscle can sustain its contraction. Tolerance to lactic acid is more. By training, you can increase the tolerance of lactic acid. Okay, you will be having less tolerance. So there will be early fatigue, but for them it will be delayed. Some drugs are there, say amphetamine. By use of amphetamine, you can delay your fatigue. Means you can perform for longer period of time. Previously, athletes used to, this is called unethical way of improving performance is called doping. So, some athlete, they improve themselves by way of training. And somebody without training, artificially, he improved the training. So, it is not just. Just you think, she studied hard for the exam. Okay, to get better result. And other person didn't study, used unfair means, copied. Okay, so both of them performed well. It is unjust, but it is justified. So by any unjust method, you should not perform. That's why Olympic Committee, they have banned use of such thing, which can artificially increase your performance. Okay, so amphetamine is one such drug. Another drug is there in the market available. There is steroids. Steroids, these are anabolic. Means it will increase the muscle mass. So if in the body muscle mass is increased, what will happen? Performance will be increased. So this is also not acceptable. You can increase artificially the hemoglobin content. That is also not done. Why? What will happen if you increase the hemoglobin content? It will be able to transfer more oxygen to the working muscle. So that aerobic process of deriving energy will be more there. Okay, so artificially he or she can increase the performance. Training, as I said, it can increase the performance. Next is race. Race, the European, American. As you see them, compare them with us, Asian, we are shorter build. But they are taller, they are having more muscle, they are more hardworking. If you go to American, European city, you will find most of the people are walking. But what we are doing here? Always using vehicles. We are not working. We don't want to work. So that for this one, they are more fit. And they don't suffer so much disease like us. Here the different diseases, lifestyle diseases are more. Okay, so that are the reasons. So Caucasians, Europeans, Americans, they are better performers. motivation. As I said earlier, motivation is one of the, another important factor. So when you motivate, our frontal cortex, they get stimulated. They send more impulses to the muscle for more contraction. So in that way, it is. But what is the exact mode, that is not yet clear. So these are the factors that affects the performance. So what are these factors? A is gender, body build, physical build, training, race, motivation, and height. Factors that affect fatigue. What are these factors? Degree of work. If you perform more work, fatigue will be earlier. If the intensity of work is more, fatigue will be earlier. So it will depend primarily on intensity of the work, duration of the work, okay, and the degree of the work. If while performing ergography using this flexor muscle, so what you will find, the weight to be lifted, if you lift weight on 500 gram only, you will be able to work longer period of time, fatigue will be delayed. If the weight is more, the frequency of contraction. Somebody is doing like this, fatigue will be early. And somebody is doing, frequency is less. Frequency is less, so fatigue will be delayed. Longer, it will be longer duration. So it will depend on frequency as well as the weight. Means force against which you will be working. Then motivation. If you can motivate, fatigue will be delayed. Fatigue will be delayed. Okay. Then blood supply. If you occlude venous blood, what will happen? The metabolites that will be produced here, this will not be drained out. It will be accumulated. And it will cause, this lactic acid will be building there, they will reduce the time of fatigue. Reduce time will be shortened. Early fatigue will be there. Similarly, if you block the arterial blood to reach there, this after some time it will not get oxygen, it will not get the nutrients. As a result, muscles will be fatigued early. So these are the factors. So factors that cause muscle fatigue are the following: depletion of nutrients, oxygen, creatine, phosphate, ATP. Because for initial contraction, as I said today, ATP CPR you will be initially utilized. Thereafter, the other system means oxidation of either fatty acid or glucose, they will provide the necessary energy. But if you block this supply, then how it will derive this energy? So fatigue will be earlier. Depletion of neurotransmitters. So for this contraction, there is nerve is coming to the muscle. Motor nerve ending is there. So this every time it is secreting acetylcholine. At a particular time, what will happen? There will not be any stored acetylcholine in the vesicles. So there will be fatigue. And accumulation of metabolites like lactic acids, carbon dioxide. So the carbon dioxide will not be washed away. So this will be accumulated there. It will produce bicarbonate ion, hydrogen ion. The hydrogen will increase the pH or decrease the pH or increase the acidity. So as a result, enzyme activity will be reduced. This is the principle of performing ergography. What is the principle? The subject contracts the flexors of the finger. Flexors of the fingers against resistance, against our weight. Using Mosso's ergogram till the finger is fatigued. The work done is calculated to study the effect of various factors on the performance. So this is the principle. Okay? The description of Mosso's ergograph. What is there? It will be your forearm. It will be, the arm will be tight with belt. So you have 3 fingers here. With this you will be pulling, and these 2 fingers will be inserted into this. So at this way. One finger within this, there is a tube. Within this tube, another finger within this tube, and the middle finger here. So there is a loop, so the loop will be here. And this loop, there is a thread. So it is through this pulley, there is a weight. This weight is of 500 grams. So you have to pull this weight using. Well, we will be pulling, contracting. Here you can see the white plate. This way. Pull. Actually, there is a problem in the paper. With every contraction, the paper moves. Every contraction moves. So you will get, for every contraction, 1 curve, gradually increasing. Thereafter, a plateau is maintained. Then the height is falling. And during this time, he or she said, I am done. Not possible to continue further. Means fatigue is there. So this is the time of fatigue. How much work is done? How much work is done during this time? How can you calculate? First, in the first contraction, you have lifted the weight to a distance. What is the distance? Write it. To be at this centimeter. This much centimeter. Here, every, so you can count all this height. So make sum of all heights. So this is the total distance. First time you have lifted this much. Second time you have lifted this much. Gradually you have lifted how much? Total of all these distances. Okay, and this is the distance through which the weight has been lifted, displaced. And what is the force applied? You applied equivalent to the weight. How much it is? 500 grams. If you add one more, that will be 1 kg. So this is the force. We can easily determine what is the force against which I am working. So it may be 1 kg, it may be 2 kg, 3 kg, 1.5 kg. It will depend. And what is the distance I have lifted it? Sum of all these heights. So now work can be done, calculated. Work can be calculated. work can be calculated easily. Work done equals to force into displacement. Force is kilogram. What is the kilogram there? And displacement, sum of all this, sum of height of all this, total height. So this mass. So it should be in meter. Because work done, unit of work done will be kgm. kgm. kg into m. kgm. This mass of work done in case of first, in case of event A. Event A is the normal. Then after this is done, this is normal, then we will be studying the effect of motivation. Again, give our or the subject 15 minutes of rest. So after this 15 minutes of rest, you repeat the same experiment. When it is about to develop the fatigue, you encourage the subject. You know how to encourage. So you encourage the subject. Again, what will be there? Encouragement. Thereafter, instead of your steady encouragement, he or she will not be able to continue. Means there will be fatigue. Now you can see, fatigue is delayed. Fatigue is delayed because of motivation. You have to discuss then how motivation delayed the fatigue, how motivation, here the work done will also be more, performance will be more, how people improves his performance by motivation. In our everyday life, we see this. Okay. If you do well in exam, in anything, if you are encouraged, then you again try hard. Give more effort. But what we are doing, if you do bad in result, we scold you. Particularly me. Instead of encouraging them. So this time you gave less effort, that's what it is the result. I know you can give more effort. So now provide more effort. Now I am encouraging you this way only. Let's see. Previously, negatively, my approach was negative, and Molopid influenced me to see everything in a positive way. So this time I am also trying positive way so that let's see whether your performance can be increased or not. Okay. Next, see the option C, or option C means stage C. Again, you give 15 minutes of time of rest. Then again, you continue the experiment. And before continuing this, at the very beginning, you have occluded the venous system. How? By using sphygmomanometer. In sphygmomanometer, there is a cuff. So you tie the cuff here, increase the pressure up to 40 millimeter of Hg. How much? 40. So at this pressure, atmospheric pressure in the cuff, at this air pressure, the venous, because venous vessels, veins are arranged superficially. So by applying equivalent to 40 millimeter mercury pressure, you can occlude the veins. So as a result, blood will not be able to drain into the heart. This venous blood, from here, where it will go? From here, blood is coming now. It is going to heart or coming away from the heart? Going to heart. So how it would enter into the heart? What is the route?
From cephalic.
Whether they will be drained into the superior vena cava or inferior vena cava? Yes. From superior vena cava to? Acha, one thing I want to ask, not regarding this. If you know this, then I will not go for this class, theory class. Do you think I should take a class on anatomy of the heart? It is needed. Or different chambers, how blood flows from every chamber. Is it needed? It is needed. I thought this is simple one, so no need of, because you have started, you learned it since you are in class 8, 6 or 7. Okay. Which ventricle is thick? Wall of which ventricle is thick? Right or left?
Left ventricle is thick. Left ventricle is thick.
Suppose I am the dead body. Okay. My heart, the heart will be at this side or in this side? From this side. This side is left or this side is left? My left, not your left. Your right is what you are looking at. That's just opposite. So here, okay. So heart is having anterior surface, posterior surface, lateral surface. How it looks from the anterior surface, how the heart looks from the side, how it looks from the back. So you have to be acquainted with it. I think in anatomy class, it is not yet performed. Okay. Our heart is having double circulation. What does it mean? One circulation is short, having short path, short pathway. Another is having long pathway. Which version is having long pathway? Systemic. Means which chambers will be involved here? Left ventricle, left atrium. Left atrium will be collecting blood from lungs, oxygenated blood, to the left atrium. Then from here it will enter in the left ventricle. This entering of blood from left ventricle, left atrium to left ventricle, is it required to contract the atrium? How it comes? Actively or passively? Don't understand. Couldn't follow my question. Blood from atrium to ventricle will be coming. So this part is either passive. Passive means without contraction of the auricle, or it needs contraction of the auricle. Initial part is passive. See, there is one valve in between atrium and ventricle. When the ventricle expands, what will happen within the cavity? There will be negative pressure. But in the atrium, a lot of blood is there. Pressure is there more. So because of this pressure difference, automatically most of the blood will be coming by passively. Okay. Then the remaining amount of blood will be entering into the ventricle through contraction of the auricle. Okay. So this is important. Initial part is passive and the later part is active because of contraction of the, we'll study cardiac cycle, auricular events, ventricular events. We'll study the pressure changes, pressure volume changes in different chambers during different phase of the cardiac cycle. Important for, and because of this, we will hear some sounds. First sound, second hertz sound, third hertz sound, fourth hertz sound. Third and fourth you will not be able to detect using stethoscope. But first and second can be used. So this is important. What is this called? Backflow of blood. Suppose some blood has to enter from ventricle into the aorta, from left ventricle into the aorta. So I pumped it into the aorta. Now, while pumping this into the aorta, at the same time, whatever some amount of blood comes back, returns within the ventricle. It is not normal. It is because of abnormality in the alveolar, atrioventricular valve. What is this called? Returning of blood into the ventricle. R-E-G-U-R, regurgitation. This is called backflow. It happens why? Because of problem in the valves. So if there is such valve regurgitation, it can be heard by stethoscope. Murmur, you have heard. So you can listen to the murmur. We'll learn it. But you have to, if you want to hear the murmur, we need a patient. Normally, not permitting. Every time, I think during next class, my throat will be okay. But it is not getting rest. So this is very important. Cardiovascular system, everything. And this knowledge should be with you lifelong. Every aspect of heart physiology, CVS physiology, must be within your knowledge. So try to, if I miss anything, you study by yourself. Okay. So in the C part, what is there? I have blocked the venous. There is venous occlusion. So as a result, there will be accumulation. Because of accumulation, there will be early fatigue. Lactic acid will be there. Carbon dioxide will not be washed out. What happens if carbon dioxide is retained? What happens? What will happen in the blood? Blood will become acidic. Because this carbon dioxide will combine with water, H2CO3, and then it will be dissociated, hydrogen ion, bicarbonate ion. And this hydrogen ion, accumulation of hydrogen ion, will create acidity. Okay. Now, our system is unique, particularly the cardiovascular system. Whenever there is a rise in hydrogen ion concentration in the blood, our body tries to prevent it. There is homeostasis mechanism. By the way, you prepare this negative feedback mechanism whatever you have written, reproduce, not at all good. You study, this is very important for you. Homeostasis, one question during a university exam you can expect from homeostasis, and most probably this is negative feedback, because this feedback mechanism is most important. You study well, negative feedback. I am not happy with the answers. So, what happens when there is accumulation of hydrogen ion? We have along the blood vessels, in particular location, we have chemoreceptors. We have chemoreceptors in carotid body. In carotid artery, there is carotid body. So this carotid body is having chemoreceptors. So when there is any increase in hydrogen ion concentration, they get stimulated. Immediately, these receptors send impulse to the vasomotor center. Send impulse to the respiratory center. And now you see, what will be there? Whether respiration will be suppressed or respiration will be increased. Increased. Why? What will happen if breathing is increased? Carbon dioxide will be washed out. The hydrogen ion and bicarbonate that was formed, they will again join and it will form H2CO3. This will be broken down into water and carbon dioxide. Now this carbon dioxide will be coming out through my expired air. So gradually, again, hydrogen ion will be coming down. Moreover, we have hydrogen, this type of receptor in the medulla. They can also sense if there is any chemical change in the blood. They have also chemoreceptors. We will study how these chemoreceptors. When your blood pressure rises, some of you have written in negative feedback mechanism. Increase in blood pressure, hypertension. So what will be there? Body will try to normalize it. First the body has to sense it. Body, any change in the body, it is sensed by receptors. So there is change in blood pressure. How body will sense it? They are got baroreceptors in carotid sinus. One like balloon-like structure will be there. So there are some receptors, the baroreceptors, they get stimulated. This stimulation goes to vasomotor center. Immediately, vasomotor center, what it will do to reduce the blood supply? From here, it will stimulate the autonomic nervous system, particularly the what? Sympathetic or parasympathetic? Sympathetic nerves will liberate adrenaline. Parasympathetic nerve will secrete acetylcholine. Now in this case, hypertension, which is beneficial, which is able to normalize the blood pressure. Now see, in this hypertension, blood vessels are more dilated or less dilated? Less dilated. That's why pressure has increased. So if I make it dilated, then blood will be flowing easily. There will be less resistance. So my intention is to dilate it. Increased pressure, so dilate it. So those who are having hypertension, what drugs we are taking? Vasodilator. So blood vessels, arteries will be dilated. So less resistance, obstruction will be there. Blood will be able to pass easily. So what, in this case, whose nervous system, autonomic nervous system will come into play, whether sympathetic or parasympathetic? Parasympathetic. Means it will, from its nerve endings, it will liberate acetylcholine. Acetylcholine causes loosening of skeletal muscle. But its effect in GI tract is opposite. Here, the smooth muscles are contracted, but here smooth muscles are opposite, relaxed. So our autonomic nervous system will act and it will increase the diameter and resistance will be less, so blood pressure will be coming down. So we have to know this mechanism. There are various other mechanisms also we will study in detail. So here also you see, if I block these, so what will happen? Metabolites, carbon dioxide will be accumulated. They will cause accumulation of lactic acid, accumulation of carbon dioxide, accumulation, and this lactic acid will create pain. Okay, and carbon dioxide will create acidity and make the muscles fatigued. Why? By increasing the pH. Decreasing the pH, increasing the acidity. So because of this, our endurance is shortened and fatigue became earlier. And this is arterial occlusion. It is further shortened. Why? No supply of oxygen, no supply of nutrients. So because of this short supply of this, at the same time, washing will not be there because not only artery will be blocked, vein will also be blocked. So both functions, both way, it will affect the muscles. So this way, these are the recordings you have to make, you have to, whatever you're finding, you have to discuss. You understood? Now the precautions. Now what precautions you will be making? What do we do actually? We don't want to do any work. I am not able to continue further. Not ready to work. Not motivated. Not willing to. So, first you should advise the subject to give maximum effort. Then this contraction should have a particular rate. In 1 minute, 2 contractions. Okay, so in this way, you have to motivate. And then the subject should continue to do the work till he or she is unable to leave the load. Same frequency. You cannot reduce the frequency, you cannot increase the frequency. So this is most important thing. You have to maintain the rhythm frequency. 15 minutes of rest should be provided between all these experiments to study the effect of encouragement and motivation. The subject should be properly and adequately encouraged to get maximum performance. For obtaining venous occlusion, I said it should be 40 millimeter mercury, and for occlude arterial system, you have to increase the pressure up to 200 millimeter of mercury. So these are the some precautions. So these are the way how you can calculate work done. Now what you have to observe? What is written there? Study the amplitude of contractions and the time of onset of fatigue. Now tell me, can you determine this time? No. Time is not written there. Even then I can measure. I know 2 contractions means 1 minute. 2 contractions mean 1 minute. So 1 minute, 2 minutes, 3 minutes, 4 minutes. So you can determine the time of endurance time. Is it? So you can determine it. Otherwise you will say, sir, how can we determine this? Provided your frequency, this frequency is maintained. Otherwise there will, whether here frequency is maintained or not. If frequency is not maintained, then what will happen? What will be the appearance of these curves? There will not be any uniformity. One will be see, these two are very close, but there is a much wider time. So here, what happens? Frequency is not maintained. Now you can measure the work done, measure the time of fatigue. Okay? And what are the important things you have to maintain? The frequency of these contractions. Important. Motivation. And suppose I have asked her, you do it. So after doing few contractions, it apnea parchina. So this will not do. So everybody should have a graph of her own. If it is not proper, he or she will get less mark. Means she or he did not cooperate well. Done the experiment well. So he or she will suffer. So you have to give your maximum effort.